So my talk is going to be a little bit more technical. I'm not sure how many of you are doing video editing now. Are you aware of video editing to read an image? Like how you read your OCT, you should know how to read an image because image exposure, that is what we need to understand. Now, this is how most images look. So I want you to read the image and just want to teach you how to read an image. This is one of the more common, video recordings we come across. It looks like this, so what are the things which you have to look for? So just for a layman's term, okay, you can say it is dull, it is dim, and the color there is a red dominance in overall color dominance. If you can, there's red dominance and there is contrast is not there. It's not so sharp. So, but this how, on contrary, if you see, this is how it looks like. This is sharp, bright. The color is well balanced. The iris color is like that, and the color of the frontal glow is there. There is a contrast. Basically, the exposure is good. This is how the difference is going to be between a good and a bad image. The question is obviously once you want to edit, can you change something? You can enhance the image. And after doing editing, you can make it look slightly better. You can add a little bit of contrast, modify the saturation, okay? But basically understand the exposure. What do you mean by exposure? The amount of light the sensor is getting. If your image is dull, it indicates the amount of light which is hitting it is lesser. It's underexposed. We need to expose it more. So if it is overexposed, we need to reduce the light. So there's other aspects now. This is basically a very poor quality video. It is bright, no doubt about it, but there's something else which is missing here. And the contrary, look at this. There is a difference between this. What are the things which are good here? Again, the focus is good, sharp, it is bright. But what are the bad things? Certain areas are overexposed. Let me just draw your attention to this, where the arrow is. We want to demonstrate how an incision is to be done. But what is happening? The area of interest where it is, that part is totally blown out. We call it blown out. The image is totally blown out. So, like in the same image, can you see that image is totally blown out where the blade is happening? It is out of focus over. So if you want to show a particular step, care has to be taken that that detail is missing. Again, it's a bright video. Exposure is very good. It's very well centered and the saturation is good enough, but everything looks to be dull and blurry. So each image, you need to be able to understand what is wrong and you have to fix it. Now, how does a perfect image look like? It has to be well centered. It has to be rich in colors, sharp, bright. Focus is very critical and everything falls in place. The details are appreciated very well. So this is how a perfect image should look like. This is what we call an properly exposed and well exposed image. So everything is as it is. This is what our ultimate goal should be, to have an image like this. Now, let me just explain now. Look at the blood vessels. What happens? There is something called as a dynamic range. In eye, we have got, this is the darker part. The iris would be a darker part here. Just let me move. This is the darker part. And the conjunctiva is the whiter part. So the camera gets confused. The camera would get confused what to expose on. So our exposure should be such that both the white and the dark parts are equally well seen. That should be your goal. So usually what happens, either the iris is seen or the conj is seen. The iris details are off. This is what our aim should be. So you should have the balance between the brightest part also should be seen well and the darkest part also needs to be seen well. So basically, I want you to train your eyes to identify how a good image would look like. This is how a good image would look like. The darkest part should be very well seen and as well as this thing. So you should, now here what happens, the question is, now I've showed you, if you want to show wound construction, this is how it has to be seen. Where the action, where it is happening, that part is very well focused. But on the contrary, you can see the image on the right, it's not focused. Most common mistake, if you capturing is not right, then you can't fix it in post. The capturing has to be good. That was blurred and this is sharply focused. So one solution for this always is, when you're trying to take a slit lamp image, always look at the monitor which is taking the image rather than the eyepiece. There is always a mismatch between what you're seeing and what the camera is seeing. The best solution always ensure that you're seeing on the monitor what the camera is seeing and just try to focus on the monitor, not through the eyepiece. This is one important secret by when you don't miss a shot. So the most common question is, can we fix it in post? Well, it can be fixed to a limited extent, not always, okay? This is what we use the software. It's a DaVinci Resolve. You identify the part which needs to be underexposed. Only that part you can bring down the highlights, the overexposed part. You can do that, and by that you can retain some amount of detail with that. So this blade part was totally reflected and gone before, and now what's happening? It's in a better way. Now you can see the details. Now this is another image. I just want you to comment on this image. Okay, the iris is extremely well exposed. That is good enough. But the surgeon wants to show the calcified capsule, but that is not seen here. Just let me just play here. The calcified capsule part is just blown out. The focus is good, colors are good, exposure is good, sharpness is good. But if you want to show this, the calcification part, that is gone. So what you do, you have to reduce the illumination. When you reduce the illumination, what happens? The calcific spot comes into focus. The details are very well seen, but on the contrary, what happens now? You lose the illumination on the iris. There is some compromise you have to do. This is what I was referring to as dynamic range. In post, we can enhance it a little bit. You can pull up the shadows in the iris details comes out. And whenever it is overexposed, it's always difficult to pull it back rather than having it underexposed. So the message here is, given a pinch, when you're finding it difficult, either overexposure is better or underexposure better. Remember, the message is underexposure is always better. You can retrieve the details in post. Now, this is a common scenario, like most videos which would look like this. Okay. So after doing some contrast correction and all those things, we can get it to it, but still it is not the best way to do it. So what makes a good video? It has to be first clear. It has to be sharp. The most important thing is center and focusing. And most young surgeons struggle at it. Okay. You are not at all centered. It will be some corner of the field it is being shown. And this is the same camera what I am using, the same microscope, same camera, but my trainee is operating under it. Because the young surgeons accommodate so much, it'll be out of field, out of focus. This is one of the biggest challenges as trainers we face. I am standing in the monitor, I can't see anything, but the trainee will say, I'm seeing everything. It's already so out of field, it's all blurry. So first learn to use the microscope foot pedal very well. That is extremely important. And the solution here always is ensure that you have a very large monitor, and the scrubbed assistant, his goal is to tell you, constantly keep telling you that whether the field is centered well or not. So having a big monitor in your TV, it should be very easily seen by the scrub assistant. So I say the scrub assistant, half the pay is for assisting me, half the pay is to ensure that my centering is all right. Okay, that is what the instruction should be. Or your fellow is there sitting inside. Because photography is all about catching the moment. A PCR has happened and that time you're not focused or well centered, the moment is gone, lost. So this was just about understanding how an image should look like. So let me go back to in detail now. So this is that software, which the interface, I've explained it, and you just have to get used to it, okay? So now, having given you an idea like how it would be, suppose if you see an image like this, what it is? It's an overexposed image. So everything looks very bright. This amount of brightness, the camera cannot handle, okay? So there is a way to read these things. Now, there is most of the softwares which you're having, they have what we call as the graphs to read whether it is underexposed, overexposed, or properly exposed. This is what we call as waveforms or parade. Now, let me just demonstrate how to read the image more scientifically in a editing software. So this is what we call as scopes. This is called as the RGB parade. So here, basically what it does is, it has got these three channels, red, green, and blue. So amount of information which is there in this is shown here. And you get readings, actually get numerical reading from 100 to 1200. So if you see, the top portion is all cut. It has gone beyond that, indicates all the channels are overexposed. So this is a more clinical way of reading how an image on a software would look like. So they've gone out of range. So the ideal range has to be between, this mark, that is 800 to this. It has to be always within this image. So similarly, you can see all this thing is out of range. This is all seen, literally seen in numbers. You can count it in numbers. This graph is called as waveform. This is called as a waveform. So again, it indicates the amount of light which is falling, and this is how it looks like. This is a bad graph. This is a waveform. This is the scope, what we call. So it has to be within this range for it to be a readable image. So can we get details back by correction? This is what we call as a node tree. And then we have got multiple tools by which we can correct this exposure issue. So there is something called as a highlight button. You go in and dial down the highlight. We're trying to do all these things. Going to dial down the highlight. You're going to increase the shadow a bit and decrease this is called as the gain. This belongs with the higher highlights. And after that, when you do that, you get an image something like this. So you can get back some details, and this is how it looks like. So this was a pre-image, this was post-image. It is not perfect, but it is a little bit better than this. So you got all these tools to control the contrast, brightness, and there's something called as the shadow, midtone, and highlights. Individually, we can alter each of them and then do. There's also called as a masking. Only particular area you want to mask, you just cover this area and adjust exposure beyond it or within it. So these tools are a little bit advanced, but all of these are available in your software. This is what we call as masking. Only this part would be changing your exposure with leaving the left alone. And when it moves, you call it add something like a tracker. So even when the eyeball is moving, the exposure which you applied will continue to do with the area which is you have involved. Now, this is after the editing and color correction, you can get some semblance. It's not the perfect one, it's some semblance, okay? So this is before editing, and this is how the graph would look after editing. You pulled back all the highlights down and brought into the visible range here. Now, looking at the underexposed video, look at this. This is underexposed video. Again, the amount of light which is gone is very less. So what would happen when you see the graph? All the graph would be very short. If you can just see, these are called scopes. When you go back and look at this scope, look at this scope here. So it is very short, okay? So you just examine this, and you know what you do? You can pull up all this data here. This will go up here. This is what it is. This is how an underexposed image looks like. So this is a very scientific way to judge it. This is all empty space in the upper half of the graph. This is how it. This is again what we call as the RGB parade. This is the waveform. It is there. It is all shrunk. It is all at the bottom of the pit. So this is a severely underexposed image. Now, can we make it look better, and how much can we look better? Okay, just see this. This is a comparison again for you to just understand. It's very simple. If it is crushed down, it is underexposed. If it is very tall and gone above what the graph can accommodate, it's an overexposed. Now, can we improve the quality by doing color correction? So again, these are called as a node tree. Okay. Now, what we begin by adjusting or lifting up the shadows and increasing the exposure. This is what we're doing. There's something called as the highlight button, and there are shadow button. These are all the tools by which you can just ensure that you look at this graph always. Ensure that you want to increase the midtone. Midtone is what the iris details would be. You increase the midtone and add a little bit of contrast, and magically the underexposed image becomes all right. So remember, underexposed image is much more easier to correct than an overexposed image. So what is white balance? White balance is the color tone, whether it is more pinkish or more orangish. That's what different the white balance. That can also be adjusted in the post, but to a little bit. I know it's a little bit too technical, but once you start editing, you'll come to know. So this is how you can always zoom in and see whether this particular area, this thing is retained or not. Again, we're using this masking window, wherein this particular area, I want to increase the exposure, not the white part, only this part. You use the mask, add a tacker to it, and then you can choose to act either on this area or this area. This is how it is going to be. So individual area where we can focus, and that part exposure can be controlled. So whatever the color correction or contrast changes which you make are applicable only to these things. And then lastly, you can always add a little bit of sharpness and noise reduction. So I'll just show you before and after picture here. Just look at it. Now this is, you add a little bit of exposure change, and this is how it looks like. So this was pre-correction and this is post-correction. it is always better to get the best, most correctly exposed in camera, but it's not possible. This is how it looks pre and post. It's acceptable, I should say. It's not very good, but still it's acceptable. So this is very dull, mushy, doesn't have any life. This is how it looks like. And the graphs also consequentially change because of the change in the parameters which we see. Just like, this is just the information which we see on the graph, and it correlates well with this image which you see. So get used to reading these graphs. Now, this is relatively a well-exposed image directly from the camera. These are all relatively well-exposed images, but still can we enhance it? Now let's look at the scopes again here. Again, go back to the scopes. Look at the scope here. You can see that, look at these, all of them are between these acceptable ranges, okay? This is what we aim for. This is a scope. So exposure is not an issue here. Exposure is all right. Only thing, you may want to add a little bit of a contrast, a little bit of a sharpness, and the saturation that would enhance the image much more. It's always very easy to correct an good exposed image rather than an overexposed or an underexposed image. So in naked eye also we can tell that, okay, this image looks all right. But when you look at these graphs, it's much more, confirmatory. Rather, I should say that this is acceptable. And here again, you start off with, there is a button called as autocorrect, which collects the color tone. And then you can use this contrast button or individual color wheels to adjust to get to the place where you would like to it. So once you're experienced in reading the image, how it looks to your eye, you can correct it in maybe a few minutes. Initially, it will take a long, but again, message here is don't overdo things. If they do overdo, then it might look a little bit too contrasty and too highly saturated, and that may not be very appealing. So that one has to be very cautious on. So this is an example of a perfectly exposed image. The graphs were all right, only we extended the highlights a little bit and pulled down the shallows. This ensures that the contrast is better. Now, you always have to zoom in a little bit and then see whether you can improve any particular part. So you can do this. You can see this is pre and post correction. You can see a little bit of enhancement is definitely there. So all this is possible provided your footage has the strength to do it. So that I'll explain what it means in a minute. So this is a perfectly exposed image. Let me just go a little bit fast now. So it's very difficult for me to explain here unless and until you're using this software, you'll come to know. And these features of color correction are available in most softwares, including the most basic ones as well, but they will not have so much an advanced feature. Like tracking won't be there, the masking feature might not be there, but it will be available in all the pro grade versions like Final Cut Pro, DaVinci Resolve, or Premiere Pro. They will be available. But the other versions, I'm not so sure. Again, this is how it looks like. So, photographing a mature cataract is always easier because there's a lot of light which comes back and hits the sensor compared to an immature cataract, where the amount of light which hits back to sensor is very less. So you can see before editing and after editing, there's not much change in these graphs. So it looks almost the same. Only thing you can see, a little bit of a saturation is more added, more colors are there, more color information would be there. So this is again this white cataract which is there, which is much more easier to do. You're just changing a little bit of a color. Usually we don't want a little bit red. We want it to be a little bit more of a, reduce the red part of it. So now coming to the important aspect of resolution, okay? So resolution is important, but remember that it is not the most important things. I have seen videos many years taken back, like, Robert Stegman was one of my inspirations, who is a South African specialist, glaucoma specialist. And he used to, I have seen his videos in 80s and 90s where there was no high definition, nothing. And his videos were stunning. Okay. He was recording in regular format itself because his exposure and understanding of the media and whatever best quality could record, he recorded there. Common assumption is that 4K is very good and any trash you throw at it, 4K looks good. That's bullshit. Okay. What garbage in and garbage out. If you're focusing and exposure is not good, it doesn't say whether you record in HD, Full HD, 4K, or even 8K. The first thing is your exposure has to be good. The definition does matter, definitely, when you want to edit, when you want to zoom in. Let me just examine. This is a 720p video, this is a 1080p video, and when this is a 4K video. If you're observing, seeing a video in a mobile phone, nothing matters. All look the same. Okay, all look the same. But only when you start zooming it, you get to know the difference. This is the same video recorded in different strengths of the video. In 3x zoom, you can see the difference appears. This start becomes grainy, this pixelization, but this holds on good. So the basic advantage of using higher resolution is whenever you zoom in, you don't lose the clarity. It becomes blurry and pixelized, and this holds on to it. And second thing would be when you want to edit and add a little bit of color correction, the higher strength file would hold on. The most common mistake all of you make while recording is being miserly on the recording quality. This is most important. I'm just trying to highlight you. This is one recording for your ESC camera, which is very commonly used. It's a good camera, no doubt about it. 1 minute of video recording shows how much MB? Yeah, it is, I think, 168 MB. Okay. So just keep in mind, this is a full HD and recording. Okay, what we have to understand bit depth here. So let me just pause here. Okay, this is a 168 MB and this is full HD and there is an 8-bit footage. Mind you, there is an 8-bit footage. This is a bit depth. And the codec which I used is H.264. So on paper, it is a full HD video. There's no doubt about it. It's a full HD video, but it doesn't have an inherent strength much. It's an 8-bit footage. And that's the reason why the storage which you're showing is just 163 MB. Now, let me just go back and just show you another 1 minute video. It's again compressed codec, same H.264. So these are all the things which actually matter how the video file eventually looks like. This is a 0.9 GB. Okay, it's almost 1 GB file. 1 minute is equal to 1 GB file. This is 1 GB file. This is a 4K of course. But what is important here would be, look at this bit depth. It is 10 bit. So you have H.264, 422. 422 is the color sampling. Higher number, higher inherent quality of the footage. So when you want to edit, this doesn't break down. The difference is, that was 163 MB for how many? For 1 minute. This is 1 GB for 1 minute. So this is what is the importance. If you have a very strong file, it is unlikely to break down when you want to edit. But if you inherently have a very small size, you can't do much with editing. So remember that. This is another camera, the Sony A7S III, same size. It is again a 4K and it's a 1 minute file is going 1 GB. And this is an expensive affair, storage costs a lot, but this is what you have to pay to get a good quality. Again, bit depth is important. So I understand it's a very dry subject. Only who are very much interested can make sense of what I'm trying to tell, because I'm sure 90% of it's going above your radar. I am sure about it. But why does it matter? Okay, why does it matter? You want to teach, you want to present in conference, journal, self-audit, and online education. But most of all, I want you all to record for only one thing, that it's going to make you a better surgeon. It has made me a better surgeon. This is the only reason why you have to record every surgery of yours. So we all learned about it. Surgical video workflow. You capture, you edit, you export. But the most important statement here is 80% of the quality is decided at capture. Only 20% you can modify in post. Okay, 80% is decided at capture. So if your capturing is good, then only you can do something in the post. People say that, you just capture anything and you can edit in post. It's not possible. So this I already showed. This is the 10-bit data and high-bit data. These are my settings which I use. If you want to take a photograph of it, you can just take a photograph. This is applicable for all mirrorless cameras, and you can apply the same thing as well. So the fundamentals of good, there is no compromise on this. Okay, you cannot have a good footage if you don't export. Camera don't make wonders. Okay, this is what make wonders. This is what my current editing software would look, editing system would look like. DaVinci Resolve, there's a problem that you need to have a very high, this GPU. It is very GPU intensive. So you have to have a very good GPU. This is a recent upgrade. and this is the Mac Studio version. This is the Mac Studio Ultra, and it is a very power hungry, especially if you want to do color correction in DaVinci Resolve. For regular editing, no issue. When you want to do color correction and all those things, you require a higher power computer. Now, difference between Windows and Mac, both of them are equal. This is more economical, but the problem is they sometimes they hang, they just stop functioning. That is, reliability issue is there, but this unlikely. But the performance is almost similar. It doesn't like it performs better than this, but the reliability is probably more with that. I think with that, I'd like to conclude. And if there are any questions, I'll be happy to answer.